We're certainly hearing a lot about diseases like measles, and this is partly because we have a very successful vaccination program in this country. But recently, we've seen a decline in uptake of childhood vaccines, and in some areas, we do have consistently poor uptake. And this means that it's just difficult to control these diseases because it's all dependent on vaccine coverage. Over the period of COVID, so during the pandemic, there were very, very low levels of all the infectious diseases, apart from COVID, obviously. They went way, way, way down, and we saw hardly any cases. And this was because, obviously, we were taking precautions like we were in lockdown, and there was a lot of advice about hand washing and distancing, and this had an impact on all diseases. So for a couple of years, very low levels. And then, of course, when people start circulating again and having normal behavior, we see these diseases increasing.
There are several diseases where I think that we really do need to be very worried, and there are several conditions where I think that we need to be very worried. So MMR, for instance, London in July, just July this year, the UK Health Security Agency issued a guidance which said there's been a steady rise in measles this year, and there's a real potential with tens of thousands of people affected with measles, particularly in London. If you're exposed to the measles virus, 90% of people will get it if they haven't been vaccinated. With mumps, before we had the mumps vaccine, there were about 1,200 people being admitted every year to hospital in England and Wales. And it was the commonest cause of viral meningitis, very scary word, meningitis, with good reason, and of children becoming deaf during childhood rather than being born deaf. And we've had several peaks in mumps since 2002. Now, that might be a combination of being too old to have the vaccine when it was first introduced in the 1980s, not having the second dose when it was introduced in 1996, or, of course, of people who, after the scare about MMR, despite the fact that it's been completely debunked, decided not to get the MMR vaccine. And interestingly, there was a real problem when the scares about MMR first came out. I was a GP who had a young child myself. I spent ages trying to explain to people the risks and the benefits, and the fact that loads of studies had proved quite comprehensively there was no evidence of a link between having the MMR vaccine and autism. But despite that, there were a lot of parents then who weren't getting their kids vaccinated. Their kids, of course, are now reaching the stage where they're going to university or college, and that's where a lot of the outbreaks have happened. And if we think about mumps, in addition to meningitis and deafness, about 1 in 25 people who have mumps get inflammation of the pancreas, 1 in 20 teenage girls and women will get inflammation of the ovaries, 1 in 4 teenage boys and men will get swelling of the testicles. And it can also lead to sterility, it can lead to joint problems, and it can lead to heart problems. People hugely underestimate the risk of conditions like measles. No, they're not meningitis. It's not, like bacterial meningitis, where there is an enormous statistical chance that you're going to end up in hospital. But to put it into perspective, I mean, we were measles-free as a country, but we lost our measles-free status in 2019. In the first decade of this century, there was a huge increase in the number of cases. And in fact, the UK Health Security Agency has just said that there's a real risk of a major outbreak this year. But to put it into perspective, about 1 in 12 children who have measles will get an ear infection, up to 1 in 16 will end up with pneumonia, 1 in 12 will end up with diarrhea, and somewhere between 1 in 1,000 and 1 in 2,000 people who get measles will end up with inflammation on the brain called encephalitis, and that can lead to serious brain damage.